Hey everyone, welcome to the Return of the Logos podcast, where we're attempting to return logic to a chaotic world by shining a light on the shadows. Hey everybody, thanks for joining us again at the Return of the Logos podcast. And good news for everybody, Andy's back.
Heidi ho.
Did you have a good vacation, sir?
I did. I had a great time with the family. Got some sun, reduced some stress.
That's what the vacation's for.
Yeah, bud.
Awesome.
Yeah, bud.
Well, we're glad to have you back. I'm glad to have you back because it's hard to talk to myself doing a podcast. I learned that the hard way.
Hey.
No comment.
No, it's impossible to talk to yourself.
Yeah. Well, it's not impossible. You just got to be a little off.
Well, the dialogue is strange.
Yeah.
When it's just yourself.
Yeah.
You know?
Yep.
But you did a good job of being like, what do you think about this? And then you pause.
Waiting for a response that wasn't coming back.
You'd let the listener be like, start talking, and then you'd interrupt them.
Sit and think about that.
Well, let me tell you.
Yeah.
No, it's good.
All right. Well, once again, everybody, we appreciate all your support. Again, you can find us on all of your favorite podcast platforms, and please follow us on Rumble. Everyone who listened to the previous podcast heard my ramblings about what happened with the Rumble. We do have a second channel that we made called Informed Public, where we're trying to put educational videos, non-political, non-partisan stuff, just general education that we feel will help create a more informed public, hence the name. So go to Informed Public on Rumble and follow that channel as well. Get some good content, get some good brain food.
Check that out, guys, because the content that Isaiah's putting on there is stuff that's not really available on Rumble. So,
yeah, that's one of the reasons I wanted to do it, because it's like I said in the last podcast, it's like you can search and find anything on YouTube.
Yep.
You know, but when you're on Rumble, that stuff just doesn't exist.
Unless you're in the middle of a pandemic, then there's only certain points of view that you can find on YouTube.
What a segue.
That's what they pay me for.
You're getting paid?
I'm the color commentator. Man, you're the talent here.
I got to talk to somebody because I'm not getting paid. So we may have given that away. We're going to talk about COVID, and don't let that turn you off. What we're trying to do here is we want to actually, in a single episode of a show, lay out a factual timeline of what happened. So it's on record. We're also going to give some comments and, talk about some personal anecdotes. And then at the end, we'll get into a little more of the philosophical underpinnings of it, what happened, why we can't forget, and that kind of thing. So don't tune out. You may be saying, I'm tired of hearing about COVID.
We know everybody's tired of this. We can never forget what happened because it can never happen again.
And I think that's the point.
Yeah. And honestly, when I go to look for information, it's always real spread out.
It's very spread out.
Like I can never just find a timeline. This is what they did and this is when they did it.
Right. And this is maybe a good way to kind of lead into this. Is that's one of the things that I learned as I was putting some of this timeline together. There were certain things that I remember.
Yeah.
Yeah. And I'm searching for it.
You can't
find it.
Yep.
It's been scrubbed.
Yep.
You may find it in one dark corner of the internet, and that's like the only place you can find it. So what I found was that legitimate news sites have scrubbed some of their articles about this stuff.
It is still relevant. I think it was a turning point for the United States. I think it was a turning point for a lot of people when you saw the entire world, an entire globalist agenda put upon the citizens of the world in lockstep. And there's a lot of stuff that we know now that we didn't know then. And I think it was a big turning point for people. I think it was a big eye-opener. People gained a healthy skepticism. If there's anything good that came out of the terrible, terrible experience, it's that.
Yeah, and I think that's the main point. That was, like you said, the turning point that made most people who were not really skeptical, don't think the media is really lying to you about this, don't think the government's lying to you about that, just regular people started to see these guys are full of shit.
Well, and you can't really deny it.
And you can't
because it's in
deny
your
it.
face, because they're making you do stuff and they're making you stop do stuff
Yeah.
that you would normally be doing in your life.
Yeah. And you see like just the blatant, outright deifying of certain individuals without any merit behind it, and the villainization of others for no reason.
The totalitarian control.
Yeah.
And the spread of fear and the use of fear in order to control populations.
Yeah. Because that opened people's eyes, I think that's why you have that whole backlash that happened against some of these crazy leftist policies that were already in place, but people's eyes opened because of COVID, and then they started looking at some of these leftist agendas, and they're like,
well, what else
whoa.
are they lying to me about?
Exactly.
Yeah.
Exactly.
How else are they manipulating me?
Yeah.
So it is still relevant. It was at the time tiring. Even though it's exhausting, it's important.
It's important. We're going to go into it. We're going to go by year, and then we'll have some clips to play in a short discussion for each year.
And we should say this isn't all the data points. We're just trying to give a little refresher, factual. These are the ones that we found to be fairly relevant. So
the ones we thought were relevant, and you can go. Do you remember the website? It's the
on the CDC. It's a COVID museum.
Yeah,
basically,
and they have a time on there. It's like 80 pages long.
Yeah,
and it's highly sterilized.
Yeah,
to say the least. So
yeah, it's definitely softened.
So, like I said, this isn't every single data point.
Yeah, we tried to condense information on that and add information that was not there.
Correct.
So this is the Cliff Notes.
This is the Cliff Notes of COVID. 2020. During 2020, 39 states as well as Puerto Rico and the District of Columbia implemented mask mandates in some form, required you to wear masks in some form. January 17th, the CDC begins screening passengers on direct and connecting flights from Wuhan, China at San Francisco, New York City, and Los Angeles airports. CDC deploys a team to Washington State to assist with contact tracing efforts in response to the first reported case of 2019 in COVID in the U.S. January 20th, CDC confirms the U.S. laboratory confirmed case of 2019 in COVID in the U.S. in Washington State. January 22nd, the World Health Organization confirms human-to-human spread of the novel coronavirus. January 30th, the World Health Organization declares the novel coronavirus outbreak a public health emergency of international concern. January 31st, the U.S. Secretary of Health and Human Services declares the SARS-CoV-2 virus a public health emergency, and the White House 2019 Novel Coronavirus Task Force announces implementation of new travel policies effective February 2nd. I've got a lot of data points for 2020 because that was kind of the biggest year. So
Yeah.
February 29th, Surgeon General Jerome M. Adams stated that proper hygiene and getting a flu vaccine were appropriate preventative actions to be taken by the public, and stated on Twitter that masks should be saved for healthcare professionals and that they were, quote, not effective in preventing the general public from catching coronavirus, end quote. CDC Director Robert R. Redfield also stated that healthy people did not need to wear masks. March. Exact date and news articles are scrubbed from the internet, but Dr. Fauci sits down for an interview with 60 Minutes and states that the general public does not need to wear masks. This video is available on the 60 Minutes YouTube channel, and the posted date was March 8th.
It might make people feel
It might make people feel better, but as far as efficacy, it just doesn't do anything.
really not going to help you.
All right, we won't get into the Fauci impersonations. We're only in March.
Yeah. He's not science yet. He's not science yet.
Now he's just some guy from Brooklyn or wherever he's from.
Yeah.
Okay, March 11th, the World Health Organization declares COVID-19 a pandemic. March 15th, states begin to shut down to prevent the spread of COVID-19. New York City public school systems shut down. Ohio calls for restaurants and bars to close. March 24th, CDC's advice regarding masking remains unequivocal. Healthy people who do not work in the healthcare sector and are not taking care of an infected person at home do not need to wear masks. March 28th, the White House extends social distancing measures until the end of April 2020. What is this, 5 days later? April 3rd, CDC recommends that all people over the age of 2 wear a mask when outside of their home. April 11th, all 50 states, D.C., U.S. Virgin Islands, Guam, and Puerto Rico are under a disaster declaration simultaneously. April 30th, President Trump launches Operation Warp Speed, an initiative to produce a vaccine for the coronavirus as quickly as possible. May 2nd, World Health Organization renews emergency declaration from 3 months prior, calling the pandemic a global public health crisis. May 28th, U.S. COVID-19 death toll surpasses 100,000. July 14th, Dr. Robert Redfield, director of the CDC, states, quote, "Now's the time to wear a mask," unquote. He added that the U.S. could get the COVID-19 pandemic under control in 1 or 2 months if every American wore a mask.
That's all it is, yeah.
It's just a mask.
Yeah.
You just need a mask. That's all. We can shut it down.
It'll be over in a month.
Yeah, 1 month. We got it.
Yep.
August 10th, Dr. Fauci says on an ABC interview that he would recommend everyone wear masks. September 15th, the CDC releases guidelines for when it is safe to reopen schools, which included spreading out student desks, staggering schedules, eating meals in the classroom, physical barriers between desks, and mandatory masking. December 11th, the FDA issues an emergency use authorization for the first COVID-19 vaccine, Pfizer-BioNTech. December 18th, the FDA issues an emergency use authorization for the second COVID-19 vaccine, Moderna. December 24th, it is estimated that more than 1 million people in the U.S. are vaccinated against COVID-19. 2020, what a year.
Wow. So they're just implementing the vaccine December 11th and December 18th. They come out with the first 2 vaccines.
Yes. And the thing that I find interesting is it's only 8 months after Trump announces Warp Speed. Now, these pharmaceutical companies were probably already working on something, but to me, it's pretty striking how fast that they spun these up.
Yeah, what do they say? It normally takes a minimum of 3 years, and that doesn't include testing.
Right.
3 years is warp speed.
That is, yes.
Right.
And what you'll remember as they're pushing the vaccine, it's safe, it's effective, you have to get it. You're killing grandma if you don't. So you're telling me that in 8 months, you have fully tested this, you know its efficacy, you know that it prevents the spread, you know that it reduces symptoms, you know all this in 8 months.
You know that people
You've done randomized control studies.
It on.
Right.
Well, that is a whole nother show about the safety standards in which vaccines are released.
Yeah, that's a whole other show.
Let alone an experimental vaccine.
And that's a good point too.
That is under emergency use.
That's a good point too.
That's basically right at the end of 2020. And so up until this point, there was no vaccine. What were doctors doing this whole year? Well, what they were doing is they were throwing the kitchen sink, right?
Mm-hmm.
They were trying to help people as best as they could. And they found therapeutics that were effective.
Hydroxychloroquine, ivermectin. Wasn't there one other one that I may be forgetting? Monoclonal antibodies, I remember, was a thing too. That
Yep. I think that came out after the vaccine.
Yeah, I think that was later.
But during this point in time, you know what they were telling people? Go home and tell us when your oxygen levels reach a certain level. They weren't telling them, take these vitamins, take these things, here's some therapeutics. They're doing nothing to help these people.
Yeah, and I'm not a doctor, I'm not a scientist, but to me, a normal thinking person that uses common sense. If there's sick people in my house, should I stay, cooped? Even if it's just me, I'm sick in my house. Should I stay cooped up in my house where the virus is just floating around in the air and all over surfaces? Or is maybe it a good idea, hey, go outside for a walk, get some sunshine, get some exercise? That's what blew my mind.
Right. You mean with all the lockdowns and everything?
Yeah.
Well, I think the biggest thing for me for 2020 is the fact that for some reason, there was one solution. There was only one solution, and it had to be the vaccine. The therapeutics could not be effective in order for them to use the emergency use authorization.
You can't grant an emergency use authorization if there are effective therapeutics.
Yes, thank you. That's stated much more clearly than I was stating it. So why was it that they had such a problem with all of these things?
Mm-hmm. Why? Yeah.
Why was it that Neil Young and every other dumb fucking hippie said that Spotify had to kick Joe Rogan off because he used therapeutics and he was better in 3 days?
Right.
That the media was in lockstep calling it a horse dewormer when they knew full well it was not.
Yeah. And I don't want to gloss over this, so I want to get back to what you were just saying. But one thing I don't want to gloss over is that the Moderna and the Pfizer vaccines were new technology. These are not a typical vaccine. They're mRNA vaccines, meaning that they code into your RNA, DNA. Mm-hmm. They code something into you that trains your body how to create. Correct me if I'm stating it wrong or non-scientifically, but it trains your DNA how to respond to these viruses, as opposed to a typical vaccine that we've had over 100 years. You put in a weakened or a dead virus.
Yep.
And then your body sees it, it's weakened, so your body fights it and it understands now what it's fighting.
Yep.
So why, this is the thing that always gets me, and the reason I don't want to gloss over it is, why were they so insistent upon pushing these mRNA vaccines, instead of just trying to develop a normal vaccine? Well, Johnson & Johnson did. I think that was Johnson & Johnson's vaccine, but
yeah.
I didn't want to, didn't want to gloss over that.
But was it Johnson & Johnson that had to remain at a really low temperature?
I'm not familiar with that.
There was one that was a live vaccination. Mm-hmm. And for some reason they had to
store it at low temperatures.
Yeah, it was like sub-zero.
Oh, okay.
Like there were people running around with like coolers of vaccines.
Instead of beer, they got their Johnson & Johnson.
Yeah, I can't remember if that was the Johnson & Johnson or not.
I think that was the only live.
But there was one,
culture.
and it was like one of the first ones, and it was untenable for them to keep it at the proper temperature in order for it to have effectiveness.
Okay, I got you.
Right?
I got you.
So on top of your non-scientific, I'll add... I see you're non-scientific and I raise you.
I raise you a complete idiot.
I too like to live dangerously.
5. I'll stay. I suggest you hit, sir.
I also like to live dangerously.
As you wish, sir. 20 beats your 5. I'm sorry, sir.
Well, I won't lie to you. Cards are not my bag, baby. Allow myself to introduce myself.
But this whole time, they're just telling people to go home and wait until you're half dead, come back in, and then we're going to stick you on a ventilator.
Yes. It comes out later that basically what they found was once you're on a ventilator, you're on your deathbed.
You're screwed.
You're screwed.
You're screwed.
You're never getting off the ventilator. You're going to die.
Yep.
Instead of giving you a therapeutic.
And meanwhile, there was things that were happening in other countries as far as therapeutics go. One of the things was like flushing your sinuses.
Mm-hmm.
So in India, they were recommending to people, every time you go out, whenever you come home, flush your sinuses.
Oh.
Like neti pot,
Yeah.
whatever. Flush your sinuses. You're constantly bringing your viral load down. So your body has time to figure out how to fight it,
Yeah.
right?
Instead of being overwhelmed.
There were a bunch of therapeutics out there. Nobody was allowed to talk about them. Nobody was allowed to discuss these things. Why is that? Well, I don't know. Pfizer could probably give you 80 billion reasons why.
Yeah, and that's accurate how much Pfizer made from that vaccine. And they made over 80 billion with a B, $80 billion from their COVID vaccine.
And so I think there were many physicians that knew what was going on and they couldn't speak up. I've got a little clip I'm going to play.
The problem is that when the data is bad and when the data is skewed, it makes it almost impossible to follow the data.
But for the physicians in that group, if they spoke up or raised their hands, and this is something I did not know until the COVID outbreak, 70% of physicians are employees. I didn't know that. If they raised their hand, they lose their job. And they were afraid. There was fear. Fear was rampant in my profession. And so people just shut the hell up. And you had hospital administrators dictating how doctors treated patients and telling patients to go home, come back when your O2 sat is 60%. This was astonishing to me. It was, I kind of actually get nauseated when I think about it. It's just such a transgression of your oath.
Yeah.
Yeah. And I will say during the whole pandemic, specifically during that first 2020, I still listen to Ben Shapiro most days. I was listening to Ben Shapiro every day because say what you want about him, whether you like him or not, he always brings, he's like, here are the facts. And then he said, here's my opinions.
Builds out from there.
Right.
Yeah.
And he was the only one that I was hearing that was giving relevant facts. And he was giving like death statistics, infection statistics. And listening to him was basically what got me to say, I think I'm going to be okay.
Yeah. Yeah. Because this was all based on fear.
Yeah.
And control.
Yeah.
Control was a big part of this.
Yeah. Because if you were watching the mainstream media, like most people were, you know, because why you're not doing anything else. You're home, watch TV, watch the news, see what's going on.
And nobody knows what's going on. So you're just listening.
Right.
You're like, I want to do the right thing.
Well, they were not giving relevant statistics.
No.
They were not saying, hey, look, here's the age group of people that are dying. Here are reasons why people are dying because they have these comorbidities. Here are the group that are not really at risk. Kids. Right?
Yeah.
They weren't saying any of that, you know? So that's why everyone was afraid. And you're like, well, why is the news doing that? Why is the media doing that? Well, keep eyes glued. And I mean, we've all seen that, 8-minute clip of news segments brought to you by Pfizer. Brought to you by Pfizer. Ridiculous.
Yep.
Okay.
So we are to 2021 now?
We're to 2021. So
yay, we made it through 2020.
We made it through 2020.
Everything's going to get better according to them.
Yeah.
Yeah.
Because, you know, everybody wears a mask. 2021, January 5th, in an interview with NBC, Dr. Fauci states that it just makes sense that wearing 2 masks would be more effective than one.
It does. It just makes sense.
It just makes sense.
Just trust the science.
January 20th. In one of his first actions as president following his inauguration, Joe Biden signed Executive Order 13991, which compels the heads of executive departments and agencies to immediately take action as appropriate and consistent with applicable law to require compliance with CDC guidelines with respect to wearing masks, maintaining physical distance, and other public health measures by visitors and employees of federal land and properties. January 21st, You got something, Andy?
Yeah, I'm sorry. I'm sorry to interrupt so quickly in 2021, but President-elect Biden promised
There would be no mandates.
there would be no mandates.
That was during one of the debates with Trump. We don't have that clip, but you can find that clip.
He did it in an interview as well.
Oh, he did an interview
Yeah,
too?
yeah.
Okay. Yeah, I know it was in the debate, and he flat out said there will be no mandate.
And you remember how he made up his own like presidential press conference, like the press conference of the president-elect?
Oh, yeah.
As soon as he won the election, he like created his own presidential
I forgot about
press
that.
conference to address the American people
Yeah.
as if he was the president. In one of those, he was asked the question about mandates, and he promised that he would not do that.
Wah, wah, wah.
January 20th,
So-
he signs his first executive order.
Yeah.
One of his first actions
One
as
of
president.
his first actions as president.
Yep.
Okay, so then the next day, January 21st, Biden signs another executive order compelling the Transportation Security Administration, the TSA, and other federal agencies to require the wearing of face masks on all forms of public transportation, including planes, trains, buses, ships, and airports. March 8th, CDC announces fully vaccinated people can gather indoors without masks. New director Rochelle Walensky states that, quote, you can visit your grandparents if you have been vaccinated and they have been vaccinated too. Oh, thank you, Ms. Walensky.
But only if they're vaccinated.
But only if they're vaccinated.
Fully vaccinated.
Fully. Yes, not even partially.
Yes.
You got your booster?
We will allow you to see your own grandparents as long as they and you have taken the jab.
As a side note, when I was looking stuff up, I saw a pretty sad video. It was like an old woman. She had to have been like late 80s or 90s. It looked like she was in an assisted living place.
Sure. Yeah.
And they had a happy birthday banner in her window. And all of her probably great-grandchildren, little kids, 7 to 10 years old, were outside of the window singing happy birthday to her. I was like, you've got to be kidding me.
Yeah.
And I mean, there's all kinds of horror stories about people who weren't allowed to go be with their loved one as they were dying in hospitals. They weren't allowing funerals.
I remember I had people that were affected by that, people that were close to me.
It was one of the most ridiculous things.
Yeah. So I'm going to save my anger for the end of this program.
Okay. All right. We'll move on.
Yeah. Sorry.
No, I took us on that.
No,
tangent.
there's a lot there.
March 29th, on her MSNBC show, Rachel Maddow states, as a matter of fact, quote, we know that the vaccines work well enough that the virus stops with every vaccinated person. The virus does not infect them. It cannot use a vaccinated person as a host to get more people, end quote.
Yep. She knows that.
She knows that. April 2nd, CDC announces fully vaccinated individuals can travel domestically in the U.S. without a COVID test. Oh, thank you. April 13th, CDC recommends pausing the use of Johnson & Johnson COVID-19 vaccine because of blood clot complications. Then, 10 days later, April 23rd, CDC recommends continued use of the Johnson & Johnson vaccine.
Oh,
You know those blood clots? Don't worry, just go for it.
why do people have all this hesitancy? Why are they so confused about whether you should wear masks or
What am I supposed to do?
Yeah.
I don't understand.
It's fine. Just trust the experts.
Trust the experts. Follow the science. April 27th, the CDC releases new guidance that people do not need to wear masks outdoors when they walk, bike, or run alone.
Oh, cool.
Yeah.
Super cool.
Yeah.
I can walk down the street by myself
with-
outside
Yeah.
without wearing a mask.
Yeah. Fully vaccinated Americans don't need to wear masks outdoors at all unless they're in a large crowd. Fully
Fully vaccinated.
vaccinated.
You must comply.
May 10th, FDA expands Pfizer-BioNTech emergency use authorization to ages 12 through 15.
Well, that seems like enough time to have long-term studies.
Yeah, for sure.
Yeah,
let's
get the kids involved.
And I can totally understand why they would want to test it on young kids because they were dying in scores.
Oh, wait, they didn't.
No.
Kids didn't die from it.
No.
Oh. But they're super spreaders.
They're super spreaders.
They're going to go and they're going to kill.
Pick their
they're going to
nose.
kill grandma that they're not allowed to see.
Yeah, because they pick their nose and they spit when they talk and they, stick their fingers in their mouths.
Yeah, so they're going to get it and then they're going to give it to grandma. But they're not allowed to go see grandma.
I don't want to state a wrong fact. I know that I did read a statistic, and literally the number of kids under the age of 18 who died from COVID, it was like ridiculously low. I'm pretty sure it was less than 100.
Yeah, like out of the whole country.
Out of the whole country.
Yep. And probably with comorbidities.
And it was kids with comorbidities that died.
Yep.
Back to the timeline. May 13th, CDC announces that those fully vaccinated can take off their masks indoors and outdoors at gatherings of any size. Under federal guidelines, those who are only partially vaccinated or not vaccinated at all are still asked to wear masks in almost all indoor and outdoor settings. You assholes.
I got to say something about this because this was the point in time where I decided to take. They promised me I wouldn't have to wear that stupid effing face diaper again.
Mm-hmm.
They said that I wouldn't have to. Indoors, outdoors. And I was like, okay, if this will get you to shut up.
Just leave me alone.
Leave me the F alone.
Mm-hmm. I think this was around the time I got the jab as well.
It was my main motivation for doing it because I was skeptical.
I was too.
I was skeptical. I was what they had chastised as a vaccine hesitant.
Yeah. I'm not going to go into the reasons why I decided to get the vaccine, but I did. Even it was against my better judgment. I didn't want to, but I did. Mm-hmm. That was one of the things I was like, fine.
It was like, that's what's going to end this?
Yeah.
Fine.
Yep.
Fine.
So that was May 13th, 2021.
Yep.
June 1st, the Delta variant becomes the dominant variant in the U.S. and kicks off a third wave of infections during the summer of 2021. June 25th, CDC releases Morbidity and Mortality Weekly Report on symptoms of depression, anxiety, PTSD, and suicidal ideation among public health workers during the pandemic. People were going crazy and getting sad and depressed. I wonder why. July 27th, CDC releases updated guidance for everyone in areas with substantial or high transmission to wear a mask while indoors, even those who are fully vaccinated. So that only took a little over 2 months. Thanks for getting that jab, Andy.
Yeah, exactly. And then they reversed it on me.
Mm-hmm. August 24th, Secretary of Defense mandated that all service members receive COVID-19 vaccination. He later rescinded the mandate on January 10th, 2023. September, COVID-19 vaccination mandated for all in federal employees and contractors. November 2nd, CDC ACIP recommends Pfizer-BioNTech pediatric COVID-19 vaccine for children 5 to 11 years old. They're super spreaders. November 4th, under President Biden's executive mandate, the Federal Occupational Safety and Health Administration, or OSHA, issued an emergency standard on November 4th, 2021 that would require all U.S. employers with at least 100 employees to require all employees, including state employees, to be vaccinated or tested weekly.
They just told me if I take the jab, I won't have to wear a mask again.
Mm-hmm.
Then they reversed course.
In May, they told you won't have to wear a mask if you get fully vaccinated.
Yep.
In July, they reversed that.
That's right.
And then in November, they're trying to require every company with more than 100 employees.
And this whole time, they're finding out that the effectiveness of the vaccine is less and less and less and less than what they originally told the public.
Correct.
First, it was safe and effective, up to 90-something% efficacy. Then it was down to 80. Then it was down to 70, 60, and it just kept dropping. It kept dropping.
Meanwhile, they're also not giving you mortality rates, which the mortality rate at this point was less than 1%.
They're not giving you mortality rates, and they're inflating the mortality rates by not reporting comorbidities or people that have other ailments.
They're reporting died with COVID as opposed to
Yeah.
died from COVID.
So if you had COVID and you died in a car accident,
you died from COVID.
you died from COVID, or you died with COVID.
And we learned later that it's because hospitals were getting, I don't remember what the dollar amount was, but they were getting a specific dollar amount for each reported death.
Yep.
COVID death.
Yep. And
All about the money.
And if you'll remember early on when they started the whole 15 days to slow the curve, they were worried about having enough hospital beds. Trump sent a aircraft carrier.
It never got used, by the way, to New York.
In New York, they had temporary hospitals set up that never got used.
And by the way, I don't want to get too far off on a tangent, but this is important.
Yeah.
Governor Andrew Cuomo sent people to stay. Instead of using the aircraft carrier, instead of using the temporary hospitals, he sent sick people into retirement homes
Yep.
to be taken care of.
Yep. Send them back.
To the most vulnerable population, he literally killed thousands and thousands of people.
Yep. And this whole time, they're not giving information about who the vulnerable people are.
Correct. But they knew.
They knew.
They knew.
But they were not, they wanted everybody to be afraid.
Yes.
They weren't telling people, if you're old, if you're obese, if you're this, if you're that, then your risk factors is higher, right?
Which makes you think that they had a different agenda. You know what I mean?
Yeah.
Other than saving people's lives.
Yeah, why wouldn't you tell people that? Why wouldn't you tell people sinus flushing for viral loads and baby aspirin and
Vitamin D.
vitamins, and why wouldn't you tell people these things? Instead, you're just sending them home. And then when you get the vaccine, it's the only solution. It's the only solution. So anyway, sorry about the tangent.
Oh, I took us even further off trail.
So we were on November 4th. Biden does the emergency order.
The executive
for OSHA.
mandate for OSHA.
Yeah, for OSHA.
All companies of 100 employees or more to require vaccination or weekly testing.
Okay, I've got a little clip. This is Biden presenting that to the American public.
Oh boy.
You know, people keep saying he's not a king. He's not a king. Biden's not a king. Okay.
Okay.
We are not servants in his kingdom.
If we raise our vaccination rate, protect ourselves and others with masking, expanded testing, and identify people who are infected, we can and we will turn the tide on COVID-19. It'll take a lot of hard work. It's going to take some time. Many of us are frustrated with the nearly 80 million Americans who are still not vaccinated, even though the vaccine is safe, effective, and free. While the vaccines provide strong protection for...
Okay, I'm going to pause it because I'm going to have so much to say at the end and I'm going to forget half of it.
All right. We're frustrated with those 80
These
million.
many people, he doesn't say himself, not yet. Many people are frustrated with the 80 million people who haven't taken the vaccine yet. Okay. Meanwhile, you have news, I use that term lightly, newscasters saying things about unvaccinated people.
Yes, I remember that.
Like, Well, they shouldn't be able to go to the hospital.
Oh, I remember that one.
Like, let them die.
Let them die. Yeah.
Let them die. So this turned into some sort of weird political outrage, demonizing anybody with vaccine hesitancy. Anybody that is skeptical of a government that has been lying to them through one of the worst times in their life and done nothing to actually help them, actually been trying to deceive them. And that stuff is coming from this man.
And let's not forget, before the election, there was an interview with Kamala Harris. Do you remember this?
Oh, I do.
Because this was slightly after Warp Speed, I think, was announced.
Yep.
And they asked her, would you take the vaccine? I don't remember verbatim her reply, but basically her reply was, if it's coming out under the Trump administration, I would have serious hesitation.
Yeah. Yep.
I'm paraphrasing, but that's what she said.
Yeah. Pretty much, I don't trust Trump. If he says it's a good thing, I'm not going to do it.
Yep. So I just thought I'd throw that in
No.
there.
I wish I had that clip because that's a valid point.
While the vaccines provide strong protection for the vaccinated, we read about and hear about and we see the stories of hospitalized people on their deathbeds among the unvaccinated over the past few weeks. This is a pandemic of the unvaccinated. The unvaccinated overcrowd our hospitals, are overrunning emergency rooms and intensive care units, leaving no room for someone with a heart attack or pancreatitis or cancer.
That's a lie.
Yes.
It's their policies that are doing that.
Yes.
This is not about freedom or personal choice. It's about protecting yourself and those around you, the people you work with, the people you care about, the people you love. My job as president is to protect all Americans.
Are you sure it's not about $80 billion for Pfizer?
I'm pretty sure it was about that.
Oh. Well, he wouldn't lie to us.
No. Not old Scranton Joe.
Yeah.
So tonight, I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. Some of the biggest companies are already requiring this. United Airlines, Disney, Tyson's Food, and even Fox News. My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see?
A safety and efficacy trial.
There's a lot more that we need to see.
We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
What a dick.
This is totalitarianism. So not only are they lying through their teeth, while he's trying to impose an unconstitutional, unlawful.
Because this did go to the Supreme Court, and this order was struck down by the Supreme Court.
Yes. And it violates the Nuremberg Code. This is totalitarianism. He's also insulting the Americans that have skepticism of all the lies that they're being fed.
It's like they think that we can't see what they're doing. They lie so blatantly, and they think that we're that stupid, that we're not catching it. It's like, no, this shit lives forever, man.
Yep.
It's on the internet. We're going to see it for the rest of our lives.
One more time.
We've been patient, but our patience is wearing thin.
We've been patient, but our patience is wearing thin.
Sounds like a threat.
Yeah, it sure does. Meanwhile, anybody that has any hesitancy has been completely demonized by the media,
And your refusal has cost all of us.
Anybody with anything that is not an approved message in lockstep with CDC guidelines, including doctors that have been treating patients for well over a year now, are being silenced on social media. Doctors are at risk of losing their jobs and their licenses
if they speak out against the narrative.
Yes. It's insane. Okay. Sorry about that rant.
That's all right.
But that's the executive mandate.
And Trump is the dictator.
Using OSHA.
Yep.
And Trump's the dictator. Our patience is wearing thin.
November 19th, FDA amended the emergency use authorization for both Moderna and Pfizer BioNTech COVID-19 vaccines, authorizing use of a single booster dose for all individuals 18 years of age. November 26th, World Health Organization classifies a new variant, Omicron, as a variant of concern.
Omicron.
Autobots, we will come for you, Omicron.
We roll. That sounded like a Bane. Were you doing Bane?
His is a little more high-pitched. Omicron. Omicron. Oh, of the Omicron I see.
Do you feel powerful?
Do you?
I give it back to you, the people.
That was pretty good. I like that.
I do also remember that our work was sort of threatening us subtly. We're going to try to keep you employed, but we're just not sure if we can if you don't get the vaccine.
Yeah, they tried to make us upload a picture of the Vax card.
Yep.
And
even though I got one,
I had one. I never
did it.
I never uploaded either. I said, nope, that's too far.
Yep.
I didn't want to get the vaccine. I did it. I had the card. I even had to show the card once at a job site in another state. But when they said you need to upload a photo of that vaccine card, I said, nope, I didn't do it.
Yep, I didn't do it either. I just felt weird about it. I was like, you know what?
It felt dirty.
It's enough. It's enough.
Yep.
None of your business.
Yeah. I was like, if you want to see it, then I've shown it to my boss. So, that's enough.
Not only is Biden essentially threatening the American public, but his sentiments were echoed throughout the media. Anybody that didn't agree with the things that he's saying were silenced on social media. And our number one health official, Fauci, I've got a little clip that I'd like to play of him. This just goes to show what he really thinks about people that aren't going to provide money for Pfizer.
Now recognize Dr. McCormick for 5 minutes of questions.
It's been insinuated that politicians, only bloggers, only conspiracy theorists are disagreeing with you. I want to point out that I'm probably the only member of Congress that actually treated patients during the pandemic from the very beginning to the very end of the pandemic, during night shifts in the ER. Thousands of patients during that time. And in 2020, I was censored. My medical license was threatened because I disagreed with bureaucrats. Literally taken off the internet. Any dissent surrounding COVID-19 treatments, mask mandates, and any public policy surrounding the pandemic was immediately labeled as anti-science. I watched as public health officials and politicians told my patients what treatment options were best for them, regardless of their comorbidities or their medical history. Despite my education and my training and my experience, my opinions were relegated to conspiracy and misinformation by so-called healthcare experts who had never treated a patient throughout the entire pandemic. The American people deserve to make medical decisions through conversations with their physicians rather than politically motivated mandates. Dr. Fauci, did you ever treat a patient for COVID during the pandemic?
I was part of a team that was at the NIH that took care. We didn't take care of many of them.
Okay, so not hands-on. Got it. Thank you. But I'm being told by bureaucrats what's right and wrong. And what's funny is everything I was censored on, I was proven to be right.
Okay, I'm just going to pause for a second, make sure you guys understand what you're hearing. So this is a representative in Congress that was an actual doctor that was treating patients during the pandemic, and he is questioning Dr. Fauci. And this is sort of a long clip, but I think it's important to understand where these ideas and the demonization of anybody that rejects the globalist agenda.
Oh, your inner Alex Jones is coming out.
They're making the frogs gay.
These globalists are coming out. They want to destroy America.
Tell you what I want them to stop making the frogs gay.
I don't like them putting chemicals in the water that turn the freaking frogs gay. Do you understand that? Turn the freaking frogs gay. Serious crap. Gay. Frogs, freaking frogs. It's not funny. I'm going to say it real slow for you. Gay. Frogs.
You said in an interview that you gave as part of an audiobook written by Michael Spector. Run the audio clip on that, please.
Listen closely. He's going to play the audio. This is Dr. Fauci in his own words, and watch him deny it after it's over.
You think can be done about it? I have to say that I don't see a big solution other than some sort of mandatory vaccination. I know federal officials don't like to use that term.
Once people feel empowered and protected legally, you are going to have schools, universities, and colleges are going to say, you want to come to this college, buddy? You're going to get vaccinated. Lady, you're going to get vaccinated.
Yeah.
Big corporations like Amazon and Facebook and all of those others are going to say, you want to work for us, you get vaccinated. And it's been proven that when you make it difficult for people in their lives, they lose their ideological bullshit and they get vaccinated.
Are all objections to COVID vaccinations ideological bullshit, Dr. Fauci?
No, they're not, and
Thank
that's
you.
not what I was referring to.
Well,
It's been proven that when you make it difficult in people's lives, they lose their ideological bullshit and they get vaccinated. How was that proven?
Beat you into submission.
What is he referring to? It's been proven.
That's a good point. I didn't even pick up on that.
I wonder if he's talking about the childhood vaccine schedule
That's interesting.
and the fact that you can't go to a public school without fighting with the administration.
About the vaccines that your kid does or doesn't have.
Yeah, to keep the MMR vaccine out of your child's veins. Anyway, sorry, I'll continue.
in reference to making it hard for people to get education, traveling, working, I'd say it very much was in context. Miss Allison Williams testified before this committee about losing her job because she sought an exemption for ESPN's vaccine mandate, which came from recommendations from bureaucrats like yourself. She and her husband were actively working with a fertility expert, a physician, and agreed with the premise that she was young, healthy, wanted to get pregnant, and shouldn't get the vaccination for medical purposes. But she was fired. That's exactly what you meant when you said making it hard for people to live without getting a vaccination. You affected people's ability to work, travel, be educated, to actually flourish in American society, to self-determine, as we're all given God-given rights. Shame on you. Americans do not hate science. The American people hate having their freedoms taken from them. You inspired and created fear through mass mandates, school closures, vaccine mandates that have destroyed the American people's trust in our public health institutions. This fear you created will continue to have ripple effects over generations to come. You have already seen its effects in education, in the economy, and everything else. Quite frankly, you said, if you disagree with me, you disagree with science. Dr. Fauci, I disagree with you because I disagree with fear.
Amen.
I think it's pretty clear.
Yeah, they were using intimidation, browbeating, shame.
When you make it difficult in people's lives, they lose their ideological bullshit and they get vaccinated. That's all about control.
Yeah.
Sorry, guys. I know that was a tangent. Where are we at here? Are we trying to wrap up?
So we're getting into 2022 now.
Okay, so that was 2021.
That was the end of 2021.
Wonderful years.
Yeah, we're getting to the waning of all of the COVID hysteria, when people were starting to actually get tired of it and see through a lot of the BS. So the timeline speeds up quite a bit here. We don't have a whole lot more as far as the timeline goes, and we'll kind of get into our thoughts.
Okay, cool.
So 2022, January 13th, the Supreme Court blocks the Biden administration from enforcing its sweeping vaccine or test requirements for large private companies, but allowed a vaccine mandate to stand for medical facilities that take Medicare or Medicaid patients. April. By this time, nearly all state-level mask mandates had been lifted, and the CDC's mask mandate for airplanes and public transportation was struck down as unlawful.
Did you ever see the video where someone was taking a video on their phone when the flight attendant announced that they struck down Biden's unlawful transportation mask mandates?
No, I didn't see that. Was it like a celebration?
Oh, it was insane. And it wasn't like just like a couple of people.
Everybody?
It was like everybody ripped off their masks, and it was like a joyous shout, scream, clapping.
Masks now optional for employees, customers, following the White House.
It's over immediately. Congratulations.
If you would still like to wear your mask, please feel free to do so, but we're ready to give them up. So thank you and happy Unmasking Day.
Well, people had enough of it, you know. To me, it was to the point of ridiculousness. I mean, people are so tired of it. They're not even wearing the mask properly.
Nobody cares. And everybody knows it doesn't work.
Everybody knows it doesn't work because by this time, studies have been released that saying that the mask efficacy is minimal.
It's all theater.
It's all theater. It basically what it had turned into was the people who were versus were not wearing a mask became basically a political divide.
Oh, it was absolutely political. So anyway, sorry about the tangent.
June 15th, FDA issues emergency use authorization for both the Moderna COVID-19 vaccine 2-dose primary series for children 6 months to 5 years, and the Pfizer 3-dose series for children 6 months to 4 years. So those were kind of the major points of 2022.
Enunciation points of 2022.
Yeah. Okay, 2023, March 28th, newly released documents show that the White House played a major role in censoring Americans on social media. Email exchanges between Rob Flaherty, the White House's director of digital media, and social media executives prove the companies put COVID censorship policies in place in response to relentless coercive pressure from the White House, not voluntarily. The emails emerged January 6th in the discovery phase of Missouri v. Biden, a free speech case brought by the attorneys general of Missouri and Louisiana and 4 private plaintiffs represented by the New Civil Liberties Alliance. Twitter files released by Elon Musk showed that Twitter blacklisted Stanford physician and economist Jay Bhattacharya for showing COVID almost exclusively threatened the elderly, severely reducing the visibility of his tweets. When Stanford health policy scholar Scott Atlas began advising the White House, YouTube erased his most prominent video opposing lockdowns. Twitter banned Robert Malone, a pioneer of mRNA vaccine technology, for calling attention to the vaccine's dangers. YouTube demonetized evolutionary biologist Brett Weinstein, who suggested the virus might be engineered and predicted vaccine-evading variants. November 30th. Texas Attorney General Ken Paxton sues Pfizer for misrepresenting COVID-19 vaccine efficacy and conspiring to censor public discourse. And let's just go ahead to wrap this up in 2025 on January 19th. In one of his last official acts as president, Joe Biden issues an unconditional preemptive pardon for Dr. Anthony Fauci, extending back to January 1st, 2014. So, I think what we've put together is a decent timeline that hits at least the major points. I think what we have here is sufficiently representative of the whole COVID pandemic in this country.
The American experience.
The American experience.
For 3 to 4 years.
Yeah. You know, this was actually an anecdote that I have. I think this was probably in like 2023. You know, my wife and I are walking outside. This is in the middle of summer. We're walking outside. There's no more mask mandates. You know, we're walking down the sidewalk, and it's a wide sidewalk. It's probably like a 3 to 4 foot wide sidewalk.
Mm-hmm.
And just me and my wife. There's a lady walking toward us. I think I may have told this story before, but we see her probably like, 30 yards away, and she's got a mask on. Middle of summer, walking by herself with a mask on.
Here we go.
And she's walking towards us. And the spot at where we're going to cross paths just happens to be where there's a driveway pull in into a business.
Yeah.
And as we get to that, she walks. It was not even like, I want to get 5 to 6 feet away from you. She walked at least 10 to 15 feet away and around us.
Yep.
And I just looked at my wife and laughed. I mean, it's like, at this point, you can only laugh at these people. You can't even take them seriously.
It messed up so many people.
Oh, yeah. People were fried.
I mean, it messed a lot of people. This whole thing did. There's still people out there today, 2025, that don't know. It's not effective.
I still crack up when I see people driving alone in their cars wearing a mask. I almost feel sorry for them, but
I was going to say that, but I don't.
But I don't. Yeah, I don't.
Yeah, because these are ostriches with their head in the sand.
Yeah,
they're not getting it.
They're not. They've basically, they're a 3-year-old with their fingers in your ear. Na 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 na. You know.
And I don't want to just say masks don't work and I don't want to just throw that out there. Let me delve into that just a little bit. So the Cochrane study proved that they were ineffective, and a lot of people already knew that, just like how they knew that the vaccines were ineffective. That's why you need another booster every 3 months. It's like, just keep going, keep doing it, keep injecting this stuff.
Yeah.
We told you it was going to work. It didn't work. We lied to you. We went through.
Well, it didn't work for stopping the spread of COVID. The question is, what did it really work for?
Yeah, what did it really do?
What did it really do?
So I've got a short little clip here that I want to play. This is Fauci responding in an interview on CNN of all places, the Clinton News Network. So this is interesting because the guy brings up the Cochrane study. He's like, how do you square this circle? Here we go.
There's no doubt that masks work. Different studies give different percentages of advantage of wearing it, but there's no doubt that the weight of the studies, and there have been many studies, indicate the benefit of wearing masks.
I'm going to refer to one of them. You've heard about it before. I heard about it from a number of radio callers. Brett Stevens in The Times talked about Cochrane. Put that on the screen. The most rigorous and comprehensive analysis of scientific studies conducted on the efficacy of masks for reducing the spread of respiratory illness, including COVID-19, was published last month. Its conclusions, said Tom Jefferson, the Oxford epidemiologist who is the lead author, were unambiguous. There is just no evidence that masks, make any difference. He told the journalist Mayan Damasi, full stop. But wait, hold on. What about the N95 masks as opposed to the lower quality surgical or cloth masks? Makes no difference. None of it, he said. Well, what about the studies that initially persuaded policymakers to impose mask mandates? They were convinced by non-randomized studies, flawed observational studies. How do we get beyond that finding of that particular review?
Okay, I'm going to let you hear Fauci's reaction, but I'm going to jump in front of him. This study, the Cochrane Review, it's like the gold standard. If you just listen to that, you realize the science, air quotes, science that Fauci and all of the...
science.
Yeah, all of the medical bureaucrats, public safety officials, it was not science that they were going off of. They were just making shit up. Literally just making shit up.
6 feet sounds about right.
Yeah.
Yeah,
they're just making stuff up. Meanwhile, you have children 2 years and older.
Who, by the way, I didn't mean to interrupt you, but
no, go ahead.
Without a doubt, young kids were developmentally disabled because of that.
My daughter was. My daughter was born the end of 2019. 11/22/19.
So as an infant and a toddler, she never saw a full face.
She didn't get to see people's faces. There's a whole developmental thing that happens. Their ability to understand and communicate with other people before verbal is nonverbal.
Mm-hmm.
And a big part of that is understanding how to read people's faces, understanding when they're sad, understanding when they're angry, understanding all of those things. Once they understand that, that's how they provide context to the verbal aspect of it.
Mm-hmm.
So we have been fighting to get her caught up ever since. She's 5 years old now.
Mm-hmm.
This is personal to me. I mean, forget the fact that I don't like wearing face diapers. Forget the fact that even after everybody else had dropped it for work, I had to wear face diapers on a plane, and I had, flight attendants coming up to me and, making sure, you can take it down when you eat.
Yeah, okay.
And all of the rules, all of the rules were completely arbitrary and nonsensical.
Yeah. Oh, because if I'm stuffing a fork in my mouth, the virus can't escape?
Yeah. Or like when bars and restaurants reopened, they had to close at like 7 o'clock, like COVID comes out at night or something.
It's a vampire.
None of it makes any sense. It's not scientific. And they're ruining children's lives. They're screwing up their development. They're taking them away from in-person learning.
Socialization.
All of this stuff. And the masks were a huge part of it. And the masks were just control. It was just about control. They don't frickin' work. So listen to what Fauci responds when he just gets done saying, it's fairly obvious that, the studies show that masks definitely work. And then the guy's like, I'm going to talk to you about this study.
Yeah.
It's the best study. Not to Trumpize it. It's probably the best.
They say it's the best. That's what I've been told.
I don't know.
So I'm going to go with that. That's just what they tell me.
Probably the best ever. Cochrane.
Don't forget that name, Cochrane.
It's the best anyone's ever seen. Yeah, so listen to his BS response. And keep in mind, this guy's in charge of public safety, not personal and private safety. Okay?
Yeah, but there are other studies, Michael, that show at an individual level for individual, when you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong. But when you talk about as an individual basis of someone protecting themselves or protecting themselves from spreading it to others, there's no doubt that there are many studies that show that there is an advantage. When you took at the broad population level, like the Cochrane study, the data are less firm with regard to the effect on the overall pandemic. But we're not talking about that. We're talking about an individual's effect on their own safety. That's a bit different than the broad population level.
You're not a doctor to any individual person. You don't have the right to tell me as an individual, if you're not my doctor, what I have to do and what I can't do and what I can do. You're in charge of public policy. How this affects the public as a whole.
Yeah.
And you're neglecting that because you want whatever it is that you want to get out of this.
And now when he's confronted with the science,
quite frankly, if you're criticizing me, you're criticizing science.
Yeah. So now that he's confronted with actual real science, his response is, well, yes, the data.
But not that science.
But that's not what we're talking about. What we're talking about is the individual. No, that's not what you've been talking about the whole time. You've been talking about public health.
Mm-hmm. Slowing the spread.
Yes. So don't say that's not what we're talking about. Of course, that's what you're talking about. That's your job.
Mm-hmm.
Like you said, you're not my doctor. He's like, it's about personal safety. Well, that's not what you said. You said that we were killing grandma, that we were killing other people by not listening to your advice. Biden said the same thing.
We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
And state officials fell in line.
And I'm sorry, but the only person in charge of my personal safety is me. I don't rely on anybody for my personal safety.
Yeah. And we're not just talking about seatbelt laws here.
Right.
I mean, it's kind of the same thing, but we're not talking about seatbelt laws. We're talking about nationwide mandates. If it's not about the public, it's not about the group, it's not about the pandemic, that's not what we're talking about. In what world does he think that's an adequate response when someone says, here's the actual science, and you guys did this to the American public? It makes me so mad. It makes me so mad. And I know it's just a face mask, but it's the symbol.
No, it's
the symbol of COVID. The face mask and the mask mandates, it's a symbol of COVID. I got kicked out of stores. My daughter's development has been stunted because of it. It's none of Fauci's business. And that's the least of the atrocities that Fauci is responsible for.
Yeah, we're not even talking about vaccine injuries.
I'm not even to that yet. So I said I was going to save my anger for the end. Sorry, a little bit out.
Well, it's understandable when it affects you at such a personal level. And that's the thing that you always have to remember when you're thinking about what the government is and what the government wants to do and the policies that the government wants to put in place. You have to understand that they are not thinking about you. You are, at best, a number to them. At best.
Yep.
Anytime you hear a politician or a public health official or any of these people saying that they know what's best for you, that should be your trigger to know that they're spewing shit.
Well, it should be at the very least be a trigger for skepticism.
Yes. Absolutely, without a doubt.
Yeah.
Okay. Now that Andy's got that off his chest.
How dare you?
How dare you?
Yeah. Okay, so I want to add a little bit about the censorship. One of the big motivations, it seemed early on in the pandemic for the censorship, was people were suspicious that the novel coronavirus research lab in Wuhan might have been where this
novel coronavirus.
It might have been that it came from there instead of a wet market and a pangolin or whatever.
There's still people that are beating this drum.
Cool.
And this article that I read was like late 2024 when this article. So apparently now there's new evidence that it actually did start in the Wuhan market. They said there was all this cluster started here, and we tracked cell phone data from some person that was there that took this picture of, they call them raccoon dogs. Have you heard of a raccoon dog?
No, I have not.
No. but it was a caged raccoon dog that was on top of a cage of some other exotic Chinese animal. And he took pictures back in like 2014 when he was there. And somehow they got the metadata from the photos and said that, yes, this is where he was. And this happens to be the same place where miraculously, when they were testing in the Wuhan market in 2019 for the sources of the virus, it was in this very spot where they found the highest density of SARS-CoV-2, whatever. There are still people beating this drum. I'm sorry, I have common sense. And I also listen to evolutionary biologists like Brett Weinstein, who's actually looked at the virus and said, hey, these cleavage sites, these spike proteins, there's no way that I can see that this developed this rapidly in nature.
Yep. Robert Malone's on the same page.
Exactly.
He was one of the primary developers of the mRNA vaccine technologies.
And it's just like, I'm sorry, but there is a novel coronavirus laboratory in Wuhan, the same city where it broke out.
Yeah.
And you want me to believe that it didn't come from there. You want me to believe that.
Yeah, even a numbnuts like Jon Stewart. Did you ever see?
Yeah, Jon Stewart. Even Jon Stewart got it.
Did you see how uncomfortable Colbert was?
Oh, he was so he was trying to
this is not an improved message. Not approved.
Yeah, he was trying to get out of that segment so bad. And we didn't even get into the FOIA requested documents that show a paper trail going from the NIH to what was the
EcoHealth
Alliance, Peter Daszak, that then funneled that money into this lab. There's a whole paper trail of that.
Yep.
But people, even before that paper trail came out, people were like, well, wait a second. Once they found out, wait, there's a coronavirus lab there?
Coincidental.
Should we look at that? No. There is no evidence that this virus came from this lab because I was sending money to them and I don't want you to know. There is no evidence that this is from a lab. It's not from a lab. There is a market with pangolins that are doing things with penguins.
They're nasty. They're nasty. They do nasty stuff. And
they're pooping all over the place.
There's a raccoon dog.
And I heard that he licked his own ass and then he pooped on the bird.
And the pangolin
then the pangolin ate the bird.
Yeah.
And then after he ate the bird, he bit the person that tried to take him out of the cage to sell to a Chinese person that likes to eat pangolins. And yes, I'm racist because Chinese people eat weird shit.
It's delicious. It's delicious if you've never had it. That's actually a great segue. I'm gonna play this is Jim Jordan asking Dr. Fauci, why was it that it was so important that it not be a lab leak? Why were so many Americans silenced and scrubbed from the internet if they suggested that it might be the novel coronavirus lab in Wuhan and not a raccoon dog effing a pangolin and then someone trying to eat it? Okay.
Doctor, why was it so important that the virus not have started in a lab?
We don't know where it started, and that's the reason why I keep an open mind. So I don't know what you mean by why was it so important. It wasn't important.
Well, you still don't know where it started? The guys you gave money to figured out in 3 days.
No.
Mr. Anderson said on January 31st, 2020, virus looks engineered, virus not consistent with evolutionary theory. The very next day, Dr. Gary said, I don't know how this happens in nature. It'd be easy to do in a lab. And then 3 days later, Shazam, they switch and say it has to be nature. So they figured out in 3 days, but you still don't know?
No, in fact, if you look at what they were saying, Congressman Jordan, They were saying that it was not a manufactured virus. It still could have evolved out of a lab.
Well, let me read something here to you.
They're not incompatible.
In our study on the censorship of the Biden administration working with big tech, I want to read you a WhatsApp message from Mark Zuckerberg. Can we include that the White House put pressure on us to censor the lab leak theory? So this is a communication on July 16th, 2021. Nick Clegg, Joel Kaplan, Sheryl Sandberg, Mark Zuckerberg. They're certainly feeling the pressure to downplay any lab leak theory and go with the natural origin theory.
Is there a question there?
There's coming. One's coming. Here's another email to Mark Zuckerberg. It says, subject line, COVID misinformation, Wuhan lab leak theory. In response to continued public pressure and tense conversations with the new administration, we started removing 5 COVID claims, including the lab leak theory. Mr. Zuckerberg responds, this seems like a good reminder that when we compromise our standards due to pressure from an administration in either direction, we often later regret it. Why was it so important the virus not have started in a lab?
Wasn't so important that the virus not. We don't know. We know
it was important to someone in the Biden administration, so much so that the top.
Okay, I'm going to pause real quick. We don't know. Do you hear Fauci just say that? Mm-hmm. We don't know. So why?
So then why
is
it?
That a conspiracy theory?
Right. If you don't know, then that should be a relevant topic to discuss.
Yes, then it's a topic for conversation, isn't it?
Yeah.
We don't know. He said that. He said that 3 times so far. Okay.
People at Meta, the top people at Facebook are asking, why are we getting all this pressure to downplay the lab leak theory? And we have an email from June of the same year, June 4th, 2021, saying the same thing. It was certainly important to somebody.
Well, what has that got to do with me?
I'm asking you because you're the expert on the coronavirus. I'm saying, why was the administration so pushing not to have the lab leak theory as something that was viable?
I can answer that. I've kept an open mind throughout the entire process.
You kept an open mind. Dr. Fauci, open.
I'm sorry to keep interrupting this. One thing that Dr. Fauci is very good at is plausible deniability. Mm-hmm. And you'll notice that he's always redirecting. Yeah. Well, that's someone else's fault. When people ask him about all of the CDC recommendations that everything was based on, he's out there, he's in the news every single frickin' day. Mm-hmm. If there's one thing that Anthony Fauci loves, it's Anthony Fauci.
Oh, yeah.
And he's always using sort of plausible deniability. It's always someone else's fault. It's always someone else's decision. Mm-hmm. Even though he's the face of the health administration and organizations in the United States.
If you're going to be the face, you better be prepared to take the heat.
And answer the question.
Answer the question.
Answer the damn question. Okay? And he never answers the question. He's like, ask them. Ask them. Is there a question there?
Was I on the email?
Yeah, exactly. So, and it's down to the fact that he consistently says, I don't mandate anything. I provide recommendations. But every mandate is based off of those.
Off of your recommendations.
So everything for him is, he's one step away from every decision that's being made.
I'm not the one making the actual decision.
He's always one step away, so he always has plausible deniability.
Just like when he killed all those people that had AIDS.
I just want to point that out, and you'll probably hear that again in this short clip here.
What happened in those 3 days? Why did Dr. Anderson and, Mr. Anderson and Dr. Gary, why did they change their mind in 180 degrees? Because what Christian Anderson says 3 days later, after he said virus looks engineered, virus not consistent with evolutionary theory, 3 days later he says the main crackpot theories going around at the moment relate to this virus being somehow engineered, and that is demonstrably false. How did they figure all that out in 3 days, Dr. Fauci?
You can do that.
Still have an open mind.
Well, what they did is that they testified before this committee. What they did, they went back and looked at the sequences and realized that their initial concern was unfounded about that, and it did not look at all like it was manufactured. But as they said in their paper, even though they feel it was more likely,
3 days they figured.
That's exactly. You could do that in 3 days. You can scan sequences in a day. You don't need 3 days.
Okay. Who's Robert Redfield?
The former director of the CDC,
Dr. Redfield, right? And he was also in the coronavirus task force. Is that accurate?
He was a member of the coronavirus task force.
And here's what he said to this committee. He said, Redfield said that Fauci and Collins left him out because Redfield suspected that coronavirus had leaked from the Chinese lab. Is that accurate?
Well, he said that, but that's not true. That is incorrect, Congressman.
Dr. Redfield's lying to the committee when he sat right where you sat?
When he said that I kept him out, that is an incorrect statement. The roster who was on the phone
was Dr. Redfield in that conference call on February 1st when you had Mr. Anderson and Dr. Gary on that call?
Okay, I'm going to stop real quick because this is a little bit of inside baseball. What he's talking about is two of Dr. Fauci's colleagues came out very early on in an email that was hidden from everybody that we later got
after FOIA requests, these emails, and that their initial conclusion was that it looks like it's made in a lab. And then within the next 2 days, they had a meeting with Fauci. 3 days later, they did a 180-degree flip whether or not it could be a lab leak or not. Mm-hmm. So that's what Jordan's talking about right now, just to provide some context. Yeah. And one other thing that I would say, Robert Redfield, who was the head of the CDC at the time, he did get iced out of a bunch of these meetings. Well, if this guy's the head of the CDC is the one that's putting out the guidelines. Mm-hmm. Why would you not want him in any of these meetings? It seems like the more information he has, the better guidelines that he can put out.
Yep. And that's a really good question, Isaiah. And that's the exact question that Jim is about to ask.
I'm as smart as Jim Jordan.
Okay, I'd take the win.
I would.
Yeah.
I like him.
He was not. And the conference call was put together by Jeremy Farrar. So no one kept him out. He said he was kept out because
did U.S. tax dollars...
You want me to answer the question?
Yeah, I would just wonder why he wasn't on the call. It seems to me the head of CDC, part of the coronavirus task force, which was formed 2 days prior to that call, would have been on the call.
Well, the call was arranged by Jeremy Farrar. You should ask him.
Okay.
It wasn't me.
Plausible deniability. Well, the call was arranged by Jeremy Farrar. You should ask him.
I wonder if Fauci was guilty of funneling money to this lab to do gain-of-function research.
Illegally, by the way.
Illegally. When he would see some of these questionable emails come through, I wonder how often he would make a phone call or an office visit to these people to say, hey, this cannot be documented.
And so it's no wonder that these two guys that both think looks like it's genetically engineered, it looks like it came from a lab. And then 3 days later, it came from a wet market.
Did U.S. tax dollars flow through a grant recipient to the lab in China?
I'm sorry,
Did U.S. tax dollars flow through a grant recipient to the lab in China?
Yes, of course. It was a sub-award to the Wuhan Institute.
And who approved that award?
Excuse me?
And who approved that award? What agency approved that award?
National Institute of Allergy and Infectious Diseases.
Your agency approved that, right?
Yes, it did. After.
Did that have anything to do with this downplaying of the lab leak theory?
No.
Nothing to do with it?
Nothing.
What do you agree that there was a push to downplay the lab leak theory?
Not on my part.
Really?
Really?
Wow. I think most of the country would find that amazing. I still got 11 seconds.
But look at the facts. I've kept an open mind throughout the entire process.
All right, I yield back.
That's a fact? How is that a provable fact that you've kept an open mind through this? It's like
the amount of power that this man wielded.
By the way,
in our country, this particular bureaucrat,
the highest paid federal employee in the country, Anthony Fauci was.
Yep.
More than the president.
Yeah, so you were talking about the Twitter files and you were talking about silencing people and how all that came out after the fact. And the people that were being silenced knew it the whole time.
Right.
So I thought that was relevant because it shows intent. It shows motivation.
Yeah.
Right?
Looking back at it now that we're in 2025, and even during the entire ordeal, I was skeptical. I'm always kind of skeptical, but everything was contradictory from the facts that I was hearing versus the narratives that I was hearing.
Mm-hmm.
And so as soon as you have that contradiction, it has to trigger something in your head like something's going on here.
If you're inquisitive.
What's really going on here? People are clearly lying to cover something up.
Yeah, what's the motivation?
What's the motivation? Why are they trying to cover this up? A coronavirus lab in this city where the pandemic started, why are you trying to cover up that it came from there? Why don't you want that information to be at least discussed? If you as a scientist have what you believe is clear evidence that it did not come from the laboratory, then why are you censoring people who are talking about it?
Yeah, what's so dangerous about that?
Yeah.
Why is that a crackpot theory? How does someone go from saying, looks genetically engineered, I don't know how this happens in nature, could be easily done in a lab, and then 2 days later, the crackpot theory that's going around out there that this was created in a lab.
Yeah, it's
dangerous.
I'm just curious as to how much money was changing hands during all of this, how much back scratching was being done.
Yep.
And before all of this too.
Yep.
You know, because there's a clear paper trail. The NIAID and Anthony Fauci was approving grants through EcoHealth Alliance that was then going into this Wuhan Institute.
Yep.
And Anthony Fauci's always been a proponent of gain-of-function research. He has a very checkered past. Robert Kennedy Jr.'s book, The Real Anthony Fauci, he goes into a lot of details about how crooked, corrupt this guy is. He hasn't been sued over the book.
Yeah.
If he was lying about Fauci,
if it was slander,
he would be sued. He hasn't been sued. And if you look into his past, he was still the man back in the 80s during the AIDS epidemic.
And he was forever effing wrong about everything that he said about
HIV and AIDS.
Yep.
He was wrong about all of it.
Yep.
And he got a lot of people killed.
And he's been in positions of power as an American public health bureaucrat for 40 years.
Yeah. You know, this is a clear example of the rot and the infection of the deep state.
Bureaucrats.
The bureaucrats. And what they've done to our country. They no longer see themselves as accountable to anyone. Put aside the fact that Fauci was probably getting kickbacks and making a bunch of money. Clearly does not give a damn about the American public if they're providing false information. And you can say, oh, well, you know, they hadn't done testing on masks. So once they got some studies done with the masks, then he changed his position to reflect the outcome of the study.
But they didn't.
But they didn't. Him and his team are all experts. They understand what this virus is. They understand how it spreads. They understand, it's a similar virus to the flu. It spreads similar to the flu. I'm sure that they understand the efficacy of masks with people who have the flu.
Respiratory virus.
It's a respiratory virus. So it's not like they're in uncharted territory. I've heard immunologists and infectious disease doctors talk about pandemics. And what they say is, you never vaccinate during a pandemic. All it does is speed up the process of evolution in the virus. And then you don't know how to deal with the variants. And you're telling me that Fauci and all of these brilliant scientists that he works with, they don't know that? Of course they know that. So why are they pushing the vaccine? Could it be because Pfizer was made $80 billion? Is that possibly the reason why none of the mainstream media would run anything but positive press for anything regarding the vaccines? Today's show brought to you by Pfizer. Could it be because that was their meal ticket? I'm tired of the tyrants. I'm tired of their bullshit. I'm tired of the lies. I'm tired of these people thinking that they're not accountable to anyone, that they can do whatever they want and just run roughshod over law, over people, over morality. I'm tired of it.
As you should be. So, before I go scorched earth on these assholes, boom, let me just try to extend an olive branch. Trust the experts, right? That's the line. Trust the experts. Let's just assume that it's all good intentions. They're all doing the best that they can. There's not corruption. There's not people getting paid in pharmaceutical companies. There's not funneling taxpayer dollars to illegal gain-of-function research and then trying to cover it up. That they're doing the best they can, and this is a terrible pandemic. Let's just assume all of that. When you trust the experts, when you fall in love with that, Dr. Fauci, all these heads of these government health organizations, what are the experts in? They're making decisions about public health. And we've already established that when confronted with actual science, Dr. Fauci said how it affects the pandemic, that's not what we're talking about. We're talking about individuals and their own personal safety, which is bullshit answer. What are the experts in? They're experts in their own field, but yet they're making decisions that affect our economy, our mental health, our children, their learning. They're affecting every other aspect of Americans' lives. And they're doing so while lying to you, telling you that they're following the science, but they don't have the science. They're literally making stuff up out of whole cloth. All that aside, let's just assume they had the best science ever and that the Cochrane Review, the gold standard, is wrong. They're making these decisions. When you say trust the experts, it should be the experts in every field. What happens when you shut down places of business and you tell people that have built a business that they can no longer operate, that they are not essential? What happens when you lock people down and you close them in their houses? What happens when you remove socialization from children? What happens when a teenager doesn't get to attend their own graduation? What happens when you plan on for 2 years teaching children through iPads? All of that stuff they are not experts on, but that was all things that they were making decisions on because of the narrative, trust the experts. Where was the weights and balances? Where were the other experts? Where were the economic experts?
Where were the psychologists?
Where were the psychologists? Where were all the people that are experts on drug addiction and suicide rates and mental health? Where were all of those people? And the only experts in the education that were involved in any of this were the teachers' unions.
Yeah. We want a raise before we come back to work.
Yeah, we're going to need a lot more money. I don't know if any of you guys ever saw that video. It was a teachers' union meeting, and it was open to the public. It was being broadcast online, and one of the teachers was like, they just want their babysitters back and blah, blah, blah. And she was talking shit about parents. The taxpayers that pay
people
her.
that pay you.
That pay her for doing nothing for a year, by the way.
Mm.
One of her colleagues were like, we're online. We're live. Anyway, trust the experts is dangerous. It's dangerous because what experts are you trusting? And trust the science is dangerous because that just means trust the experts. So whatever they say science is, that's what it is. It's not a holistic view. And the damage that they did to children, the damage that they did to our country, our economy, I don't even think it's fully played out yet.
No. You'll start seeing the real effects within the next 5 years as kids that are like your daughter's age and maybe a few years older, as they get into their teenage years. I think is when you're really going to see it.
Yeah, I mean, it's just what a dramatic effect that trust the experts has. So I know that didn't sound like an olive branch, but that's the best I could do. If they had the best intentions, it was still the wrong thing. The cure was worse
than the disease. Because the disease was not deadly to children, and children were damaged and hurt. We don't even know the implications of that. And they lied to us the whole way through. So now that I'm done with the olive branch, let's just play a little game here, Isaiah. It's called Lie and Truth. Tell me who said it first, and I can tell you the answer.
So I'm going to tell you the lie, and then you try to tell me the truth. Okay. Lie. March 2020. It will only be 15 days to slow the spread.
Truth. You're going to be locked in your houses for at least 4 months, probably longer.
This is true. Other aspects of truth are 2 years of mandates, lockdowns, quarantines, shaming, threats, hysteria, and travel restrictions. That's what 15 days to slow the spread means.
That's what it turned into.
Okay, lie number 2. Masks and social distance are effective public health measures.
Truth. We just kind of made that shit up.
That's actually, yeah.
Pretty close.
Yeah, so to be a little bit more specific, the Cochrane study provides that masks are not effective. And the 6-foot distancing was an arbitrarily selected number with no science behind it. We know that to be true now.
Yeah. I don't think you can spit on me from 6 feet away.
Follow the science. Follow the science. It's not even science.
No.
They just made that number up. Okay. Lie number 3. December 2020. President-elect Biden promises that neither masks or vaccines would be mandatory.
Truth. I'm going to make your life so miserable that you're going to get it anyway.
Yeah. The truth is, as soon as he was in office, he began doing exactly what he said he wouldn't do via executive orders. On the 20th of January, he signed his first.
Yep.
And then he signed 10 more the 21st.
The 21st, yeah.
Lie. The lab leak was a conspiracy theory and racist against the Chinese.
Racist!
That's right.
Truth. Anthony Fauci loves Chinese people so much that he gives them money to make bat viruses infect people.
That's actually really close. Truth is, through EcoHealth Alliance, Fauci funded gain-of-function research at the Wuhan lab with American taxpayer dollars. Anthony Fauci had a vested interest in it not coming from a lab. Okay, 2 more. Lie. If you're vaccinated, you can't get the coronavirus, and you can't spread it, and you don't have to wear a mask anymore.
Truth.
This one's pretty easy. You can get
I'm
it.
trying to come up with something clever. Come on, give me a second here.
I'm sorry.
Truth.
Opposite of everything you just said.
Truth.
Okay.
John Jones was an amateur.
Oh, okay. All right.
Isn't that the guy's name, the Kool-Aid guy? You know who I'm talking about?
Oh, yeah.
No, the guy that the poison Kool-Aid, the cult leader guy that got all the people to drink his Kool-Aid?
Yes.
Okay. It's not as funny when I have to ask if that's the guy's name.
So, truth. You can get it, you can spread it, and you will still have to wear a mask.
Ding, 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 ding.
Basically the exact opposite.
Yeah.
Okay, last lie. The vaccines are safe and effective.
I feel like my heart's pounding extra hard.
You're getting pretty close. Yep.
It's like a heart attack. Oh, wait, I just developed a gluten allergy yesterday also.
That's pretty good. Truth. Vaccines are not effective and require endless boosters. And young, otherwise healthy athletes will begin having cardiac arrest due to myocarditis. And so that's our truth and lies segment.
I think we should try to implement that in future episodes.
Yeah.
Make it a game.
It's kind of fun.
It's kind of fun.
Yeah.
I'll have to work on my quick-wittedness.
Well, you already knew all the answers too.
I know.
Like, it wasn't very challenging.
Well, that's the only reason I could give fairly quick-witted answers.
Well, but I believe for a lot of people out there, I don't want to say a lot of people, some people out there still have no idea what was perpetrated on them.
Yeah, and what was the reason it was perpetrated? So I will give a disclaimer on this. It's kind of a muddy process trying to find the mortality rate for COVID.
Yeah.
Everybody's fudging the numbers a little bit.
Just like they were in the hospitals during the pandemic.
And that's part of the reason why is because they were calling people who died with COVID as people who died from COVID. And so the numbers, it's hard to get a good grasp. The other thing too that they do is they give you an infection fatality rate and then they give you a mortality rate. So the infection fatality rate is basically of the number of people who were infected divided by how many people died. The mortality rate is basically your chances or your probability of dying because it's the number of people who died out of the entire population.
Well, that's fair because it was the entire population that had to deal with all their BS.
Which, yeah, I think you're right. I think that's a fair number to give.
They told us it was the most dangerous thing in the history of ever and that they were going to destroy the economy. They were going to destroy our children. They were going to get a bunch of people addicted to drugs and people committing suicide at phenomenal rates. Oh, wait, they didn't tell us any of that stuff. Yeah. That's just what they did.
That's just what they did.
Yep.
So if you want to go with that number, the mortality rate or the probability of dying, and this is from worldometers.info. This was last updated April 13th, 2024. Mortality rate was 0.28%. So of the entire population, 0.28%.
This is global or United States?
This is in the U.S. According to this particular source. Like I said, there are other sources that give you slightly different numbers, and it's different in other countries.
Yep.
But it's never, if you go by the crude mortality rate, it never, ever goes
never
over
1%.
It never makes it to 1%.
Never. You have a 99-point-something%
chance of living.
Of
surviving.
Of surviving.
And how many lives did we destroy for that point?
Yep. How many people lost their livelihoods, lost their jobs?
Yep.
How many children lost their education and had their potential stunted?
How many children didn't get to say goodbye to their grandparents who died?
It's maddening. How many people didn't get to have Thanksgiving with their families?
Didn't they do that like 2 years in a row?
They recommended that you not meet with your families for Thanksgiving.
Yeah. And by this time, they had already started seeing the numbers of suicides go up and the cases of depression and all that. They'd already seen all that going up. So what do? Yeah, don't go see your family. Mm-hmm. Don't go to the one place where you could get some happiness. Don't do that.
Well, we've talked before about the destruction of the American family and the intent behind that. I won't go into that any further, but
I want to just give one more anecdote before we kind of talk about like a general philosophical thing about this, just to speak to the ridiculousness of the masks. While all of this was going on, I was actively working on construction sites. For anyone who's ever worked on a construction site, you would probably already understand how ridiculous it is to be asked to wear a mask while you're doing work that could potentially end your life. While you're up in a hot, sweaty rafter, sweating your ass off, trying not to fall and break your leg.
Or 60 foot up in a lift.
Or 60 foot up in a lift.
Yep.
Absolutely ridiculous. You're actually working hard, and now it's twice as hard to breathe. That was one of the things that I remember that struck me as like how absolutely ridiculous it is.
It was all theater too.
Yeah.
So like your day was unnecessarily hellish. When you're on a construction site, for those of you that don't know, it's a whole nother world, okay?
Yeah.
It's just people banging on stuff.
Yeah.
Just ear raping you and rednecks, and they all want to fight. It is not a...
It's not a place for soft people.
No. Like you have to come with it, and you have to stand your ground. And in the business that myself and Isaiah are in, you're normally the guy wearing khakis, which makes you weak out of the gate because you actually like have a decent appearance in case you are confronted with a customer. Meanwhile, everybody else is cussing and spitting and dipping and and fighting and cursing and
it's
writing racist things on the portalets, and you got to go shit in the 110 degree hot box. I mean, it's literally torture.
Yes,
it's literally torture. There's no running water. It is a terrible, terrible experience. And half the time you have to wear a helmet and you have to wear safety glasses. You can't.
Your mobility is already limited.
Yeah, you're wearing some ridiculous safety vest.
Yeah.
So you're hot, you're sweaty, your safety glasses are fogging up. You got to wear this stupid helmet.
And now I got to put a mask on.
Climbing up and down ladders and doing dangerous stuff.
And
now you can't breathe.
And I would say to anyone, if you wear glasses, put a mask on with your glasses and tell me how much they fog up when you breathe. So imagine that you have to wear safety glasses to keep your eyes safe.
Yeah.
And you got to wear a mask. And now I can't see.
That'll piss you off.
Dude, I was so mad every day I had to be on a construction site. I was so pissed. It's just absolutely ridiculous that you're telling these guys,
grown men
who are risking their own safety anyway. Hey, by the way, I know you might cut a finger off today, but go ahead and wear this mask so you don't get sick.
Can you pinch that over your nose a little bit? It's hanging down a little bit. Can you?
Yeah. So anyway, that's just one little anecdote that I wanted to throw out there.
No, that's a good anecdote. I have a couple. So I have a close friend of mine, really close friend of mine, that developed a heart condition after the vaccine. So that's a real thing. It's a real thing, and it's kind of serious, and it's going to be with him for the rest of his life. I have a guy that used to play keyboards for me, passed away during the pandemic, and they couldn't have a funeral for him. It was a year later.
That's so ridiculous.
That I put together a band for his celebration of life. So he was just in an urn.
Ridiculous.
For a year. That's because of COVID policies. That's a pretty sad one. On a lighter note, I got banned from Music Go Round. It's like a Play It Again sports for those of you that don't know. It's like a Play It Again sports for musicians. I've done a ton of business with these guys, but they're libtards, and they had policies that made no sense. They didn't even follow the ridiculous guidelines. They made you wear plastic gloves when you came in their store. And like the CDC's was like, don't do that.
Yeah.
Like they were like, it actually makes things worse. Like, don't do that.
Yeah.
Like latex gloves or whatever.
Yeah.
They would make you wear latex gloves and a mask, of course. You know, before you buy a guitar, you want to play it.
Yeah. They wanted you to wear gloves.
They wanted me to wear plastic gloves while I was testing a guitar. They wanted me to provide assurances that I was going to buy it.
Well, if it sounds like shit, I'm not going to buy it.
If they were going to let me take my gloves off to play it. I respected their wishes, and I was like, dude, I can't feel this. I don't play a guitar with plastic gloves on. I don't even know what this is.
Yeah.
And they graciously allowed me to test out the guitar without plastic gloves on. And I ended up buying the guitar. And I'd done a lot of business with them. I'd sold them instruments, and they're getting quality stuff at 60% of what it's worth. So it's a good deal for them because they got to resell it. I understand. I was in there one time, and they had two guys that walked in. One of them had a little kid with them, carrying a little kid. I think it was a little girl. And they said she has to have a mask. And this is after all that mask mandate stuff was winding down.
Really?
And they said she has to have a mask. And the guy's like, well, I've never heard that before. Like, I think he said she's not even 2. Because the CDC had some stupid fucking thing about
2 years
old.
2
years old.
Yeah.
Which is ridiculous anyway. And I just pictured myself with my little girl, who was about the same age, in that situation, being kicked out of a store because I didn't have a mask for my baby. It bothered me, especially after all the nonsense or whatever, that I'd been putting up with. I went in there after mask mandates were lifted in Indiana, and every other place, the bars were open, everything was open. I went in there. The guy at the counter said, yeah, you have to wear a mask and the stupid gloves. And I said, I'm vaccinated. Like, this is after the lie. So I'm fully vaccinated. I'll show you my card. He said, it doesn't matter. I left the store, and I was just like, okay, I can't do this anymore. I left a poor review on Google. A week later, I got a call from the owner, this douchebag, libtard. He always wears tank tops. He's like, anyway, I'm sorry. I'm sorry. This is a stupid story, but after the death of my keyboard player, I'm trying to
lighten it up.
Yeah. So he calls me, and he's like, did you write this review? And it wasn't like a horrific review. It was like, great guys running a local business. I do, however, disagree with some of the way that they treated their customers during COVID and their COVID policies. Because I didn't like seeing that guy get kicked out. I felt like that was just total overkill.
Yeah.
And I saw myself with my little girl. I was like, I went in yesterday. I'm fully vaccinated. There's nobody within 100 miles that is mandating masks, and this store still is. And he called me up, and he's like, did you write this review? Like, he was all bent out of shape or whatever. And I was like, yeah. I was like, yeah, I wrote a review. He's like, well, is there any way you can change it or whatever,
No.
And whatever. No. And I was like, I said my piece. He was like, I understand. There's just bad reviews really, really hurt us or whatever, blah, blah, blah. So I went and changed my review. I changed it to a 4-star review instead of a 1-star review. But I still left some of the content in about disagreeing with their COVID policies. But other than that, I softened it up, and I said they're good guys and they're fair and good prices or whatever. And I thought, it's a 4-star review. No one's going to read past the first 2 sentences anyway. People are either looking for the 5-star review
or the 1-star.
Or the 1-star.
Yeah.
They're like, what's the best? What's the worst, right? He called me a week later, and he's like, did you change your review? And I was like, yeah, I did. He's like, you're banned. And I had store credit, literally like $1,000 of store credit with them. I'd done so much business with them. He's like, you're banned. Do you understand? He kept saying that, like,
Like, give me my $1,000,
really,
bitch.
It was really weird. He's like, you're banned. You're never to come in the store again, blah, blah, blah. And he's like, trying to be tough. Like,
right, yeah.
Why don't you say it to my face that I'm an asshole, you know?
I'll come say it to your face.
And I was like, I'll be there in 20 minutes. Literally.
Yeah.
You know, and he's like,
you're banned.
You're banned. You can't come here or whatever, you know? And he tried to tell me when I was supposed to come in to get my money that he owed me. And I was like, fuck that. Drove over there, walked in the door, and he had customers in there, and he knew
He knew it was you.
He knew I was not one to be
trifled with.
Fucked with, yeah. So he asked me to stand outside, wrote me a check or whatever. And I tried to talk to him. I tried to talk to him on the phone, and he hung up on me. I tried to talk to him when I was in there.
Mm-hmm.
And he said some fucking libtard nonsense and then walked away.
What a douchebag.
You know, people went insane.
People went insane, yeah.
People went insane, and they demonized anybody that did not toe the line, and it became political. And it doesn't make any sense to me why it became political. Why are a bunch of liberals fighting for the rights of pharmaceutical companies?
And the state.
And not the people.
Mm-hmm.
Like, what is wrong with you guys?
Because they're not liberals anymore.
What is that?
They're part of a cult. And we've talked about this before. You know, there's no coherence to it. It's just whatever the machine says, whatever the group decides is the orthodoxy for the day. They've lost all ability for critical thinking. For their entire lives, they've lived in a state of abundance.
Victory has defeated you.
Victory has defeated you. They've had no real hardship in their lives. They expect everything to be the way they want it. And if things aren't the way they want it, they don't know how to put it that way. So they want the state to do it for them, which is the complete inversion of what liberalism actually is.
It almost seems like they want hardship in their lives, though. Like they want to be victims of something somehow.
Here's the thing. They don't really want to be victims. They want everyone to believe they're victims.
Yeah, so some sort of weird status symbol in the...
It's a status symbol.
In the psychotic mind.
Yeah. You know, this goes to a broader point about our society and our culture. We've been coddled for way too long. We've had it easy for way too long. It's like Abraham lived in his father's tent until he was 70 years old.
Mm-hmm.
Didn't want for anything. And had a real comfortable, cozy life.
Until God gave him the call to adventure.
Until God gave him the call to adventure.
Yeah. Yeah.
And his adventure was a very difficult journey.
Mm-hmm.
But because he went through that journey, he's now the father of nations.
Some people never get out of their dad's basement.
Some people never get out of their dad's basement, you know? And this is what I see as the fundamental issue in our culture right now. The problem is abundance, and the abundance creates a lack of effort
and accountability. Yeah.
Right? And then add on top of that an increasingly non-religious population separated from morality, separated from the source of morality.
Separated from God, yeah.
And that's where you're at. I just don't see it any other way. I don't see a world where there's anything else that has put us where we are.
Yeah, it's just so self-serving. I guess I can see where you're coming from there. It's all about self. It's all about me. They're the star of their own show.
Mm-hmm.
Yeah. And they get pissed when nobody wants to watch.
Right.
Like, nobody gives a shit.
Yeah, nobody cares. Nobody cares, man.
Yeah.
I don't care.
And they're really upset about it.
Yeah. And, you know...
So they become more and more dramatic.
And the reason that I know that this is right is because my wife works with elementary school kids. The way that these kids are treated They can't be touched. You can't discipline them in any way. They throw a fit. You just sit back and let them do it. And then afterwards, they give them their teddy bear, or they put them in the seclusion room with the toys.
Almost like a reward.
They give them a snack to calm them down.
Yeah.
They get rewarded for the behavior. That behavior is just a 7-year-old version of what these 20 and 30-year-olds are doing.
Yeah. Well, and I think the colleges have a lot to do with it too.
Yeah, the colleges have something to do with it. The indoctrination trickles down. It's trickle-down ideology instead of trickle-down economics.
I don't know the answers to all this stuff, and I'm not a doctor. But if you're paying attention, common sense can guide you to some basic truth.
Yeah,
you know?
that's all I do. Like, I'm not like ridiculously smart.
I'm not saying I got it all figured out. Yeah.
Yeah, and the same for me. I'm not ridiculously smart. I don't have it all figured out. You know, I'm sure that there are huge gaps in my knowledge base.
Yeah.
But I'm able to put 2 and 2 together. I can interpret what I see and what I hear in a factual way.
Yeah,
that's it.
Why don't you guys explain to me why they lied to us about everything for 3 years? More. Why?
Hey, you that's still wearing a mask.
Yeah.
Explain to me why I'm wrong.
Yeah. Explain to me why the Cochrane study is not valid. And I think it's just because they're fixed. They've been driven mad.
I think so.
And they're dedicated to it, because if they were to go back and be like, oh, everybody that wasn't wearing a mask that I was a total jerk with. I mean, there were public confrontations, you know.
Videos of them all over.
Yeah. There was a lot of confrontation. You know, forget the fact that George Floyd was in the middle of all this. I'll throw out a couple conspiracy theories. My uncle on my wife's side, I believe he had COVID in the middle of 2019. He had some sort of respiratory virus, and he was on the edge of dying, and nobody knew what it was. And he was in the hospital for like a week.
Wow.
Everybody was confused. And it was all of the symptoms of people when COVID came out.
That's crazy.
This is well before the WHO stated that there was a global pandemic in place. So I don't know that I even trust the timeline that they give us on whether it was a pangolin or
a raccoon dog,
a raccoon dog or a lab leak. I don't even know that I trust that. So that's kind of scary. It's interesting that when all of this happened, there were a bunch of election laws that were ignored.
Oh, yeah.
In states all across our country. There was mass
mail-in votes.
And people didn't request them. They just sent out ballots everywhere. I remember seeing people on social media being like, what do I do with this other one?
Yeah.
Like people that got like 2 and 3
I got 5. I don't know what to do.
Do I get 2 now? Or, I mean, they changed everything about that election.
Yeah, they did.
So
they did.
What is going on? What is going on there?
Well,
why are they protecting China? I think it's
like
Jai with a G. China.
A lot of. Sorry, I would say that.
China.
Sorry. You know what I'm saying.
Yeah.
I got Andy really good. He's laughing so hard he's coughing.
A lot of vagina. Is that
Austin Powers?
Austin Powers, yeah.
Well, I think that actually is a portion of my conspiracy. I'm going to give you my conspiracy theory. First thing is, I'll say, I'm going on the record, not even a few weeks after this happened, my wife can attest to it. I told her, I said, this leaked out of a lab. I guarantee it. Now that I know Fauci is more than likely mostly responsible. My position may change, my view changes a little bit, but my position was always, we tell China, you unleash this on the world, F off, we're canceling all of our debt to you. Now, that could have sparked World War III, but I think the truth would have came out, it was like, hey, your asshole guy was the one that funded it. That could have brought everything out, you know. To go to my bigger point, in a world where the conspiracy theories are true, this is my conspiracy theory, I'm almost there with Alex Jones. Like, I really do think
the global elites.
There are, I really do, the more all of this starts to unfold, I really do think that, you know, when you talk about the World Economic Forum, when you talk about
the Great Reset,
when you talk about the IMF, when you talk about all this stuff, it seems abstract. But when you see something like the pandemic play out across the entire world and what happened, when you saw the authoritarian boots come down on people's necks, when you saw essentially elections get taken, when you saw the narrative push,
the widespread censorship,
the demonization of the other that doesn't want to take what they're offering,
the mass psychosis.
I think that this was a test run for them to see where their boundaries are, to see which people are going to offer the resistance, which leaders are going to offer the resistance. Because you can't deny that there's a populist movement in the entire world right now.
A global.
And they're trying to quash it. And I think that was their test bed to see where their boundaries are so they know how to navigate the next 5 to 10 years.
In my opinion, America failed. We failed the test. We can never let this happen again.
In many respects, I agree. I think in some respects, I would respectfully disagree. I think that we did show that, hey, we do have a segment of our population that says, F you.
Speaking for myself, it took me way too long to speak up and stand up. That's a personal analysis of me trying to figure out what was going on, when it was going on.
Mm-hmm.
I had skepticism, but
I think for me, after a few months of the masks, like my wife had to tell me every time we'd go into the grocery store, put your mask up. I'd have it like down, all the way down on my chin.
Yeah.
Because I was like, this is stupid.
Don't get me wrong. I was non-compliant.
I was as non-compliant as I could be.
I was one of the people that Biden said was losing his patience with, for sure. But we can never let that happen again.
Never forget.
Because there is something absolutely sinister behind it. And there's still people walking around wearing masks and thinking all that stuff was truth. And it was predominantly lies. And it was all perpetrated because of a 0.2% mortality rate.
Mortality rate, yep.
I don't know. Maybe compare that with the flu and see if the cure was worth it.
It wasn't.
It didn't do anything that they said it was going to do. And now they're putting COVID vaccines on the childhood vaccine schedule.
It's retarded.
I mean,
that's retarded.
It's continuing. It keeps going. So, as Trump stated,
but to every COVID tyrant who wants to take away our freedom, hear these words: we will not comply. So don't even think about it. We will not shut down our schools. We will not accept your lockdowns. We will not abide by your mask mandates. And we will not tolerate your vaccine mandates.
That's why he's the leader of the free world right now.
I think so, yeah. I think so. Well, Nobody can wrap it up better than Trump. So
Nobody.
They say he's the best. I think he's the best. That's what I've been told.
Probably the greatest.
Probably the greatest of all time.
Basically, all I've done is keep my promise.
That actually worked.
That actually worked.
Thanks. Thanks, buddy.
So thanks, everybody, for tuning in to this one. I know everybody's probably tired of COVID, but we wanted to do this just to get this out, and then we'll move on. So thanks again. Follow us on Rumble, on both of our Rumble channels, Return of the Logos and Informed Public. Follow us there. And like I said in the last podcast by myself, please engage with us online. We want to build community with you guys. We want your input. We want to do all that. That's the only way that not just the podcast grows, but the community grows, and that we don't lose the culture. That's what we have to do. We have to make sure we do it.
Yep. And you can do that on YouTube. You can do that on Rumble. You can do that on X. I believe you can even do that on Spotify.
Yes. You can comment on Spotify. You can comment on YouTube. We're on YouTube. You can comment on Rumble. You can get us on X at Returning Logos. You can get us on True Social at Return of the Logos. So please, 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 please engage with us. Help us build the community, right? We're not just doing this for ourselves. That's not why we're doing it. We're doing it because we believe in this. So help us do it. Please help us do it. And even if you don't comment, share it. All right?
Yeah, help us engage this conversation. It's part of a much broader conversation. Each episode we delve into different things, but this is all part of a big conversation, and it all needs to be had. We got to do it while we can before they take that away from us.
Amen. We'll see you guys on the next one.